Joining us for this week's Your Health segment is Dr. Kathleen Neuzil, Director of the Center for Vaccine Development at the University of Maryland School of Medicine. Doctor, thanks for being with us.
I'm happy to be here.
We're here to talk about the flu shot. Who needs to get a flu shot this year?
Well, that may be the easiest question that you ask me, because in the United States, we recommend that everyone 6 months of age and older receive the influenza vaccine.
I thought it was more focused on people who were at greater risk, either had an immune system issue, were elderly, or had some other potential complication.
Now, it's certainly most important for those groups of people, and that's because they're the most likely to be hospitalized or die from influenza. So babies, as you've said, people over the age of 65, certainly as we get older, again, we're more likely to have the severe complications than everybody in between, with cancer, with immune system problems, with heart and lung disease. But any of us can get influenza. And I think, importantly, any of us can spread influenza to those vulnerable people.
So there's this concept of herd immunity, which is really with all these vaccinations, that once you get to a kind of a tipping point, the odds of a big outbreak really diminish.
Correct. Now, with influenza, we really have to vaccinate a lot of people to be able to stop an outbreak. But at the micro level, at the local level, we can have a lot of effect. So within a household, for example, it can really make a difference if everyone is vaccinated, if children are vaccinated to keep from spreading influenza to adults. And we really have to protect those babies younger than 6 months of age who are too young to receive an influenza vaccine.
Let me remind our viewers, if you have a question about the flu or the flu shot, give us a call. We'll have the number on the screen. You could also tweet your questions. Twitter address is @MPTNews. So I've gotten a flu shot, truthfully, probably like every other year or something like that, but going back a long time. Do I have any residual immunity after, I don't know, 15 shots over the years?
You probably do build up some immunity, but it's still important to get the new influenza vaccine.
Why is that? Because you think of like the childhood vaccinations, get the shot, maybe 2, you're done.
Yeah, influenza is a very tricky virus. It's constantly changing. And that's why it's the only vaccine that we actually have to change twice a year. There's a Southern Hemisphere and a Northern Hemisphere vaccine. So the measles virus, it would be the same measles virus throughout your lifetime, and a measles vaccine works through your lifetime. But an influenza vaccine has to keep up with the changing virus.
How good a match is this year's shot for this year's flu?
So I'm always very cautious about predicting. I like to say that influenza is predictably unpredictable. However, in this early season, we've had very few isolates, but the ones that we have appear to be a good match with the vaccine. So that's good news.
And by isolates, you mean people with the flu?
Right. So I mean people coming in with the flu.
There's no big outbreak yet.
There is no big outbreak. There's some mild activity in Maryland right now.
What makes it pick up? It's the idea that we're all indoors closer than why does it spike in the winter every year?
Yeah, again, we don't completely understand it. It probably has to do with the cold, dry season allows the virus to be transmitted more easily. And then, as you've said, we tend to be closer together and more indoors in the winter as well.
Let's grab a phone call. John in Harford County. John, thanks for the call. Go ahead. John, are you there? Yes, sir.
Yeah, I'm here.
What's your question?
Well, I told the other lady I had the flu shot one time in my life. I'm 83 years old, and it was 1957, and I didn't get the flu then, but I got the flu about 2 months later, and it's the only time I ever had the flu in my life, and I've refused to take a flu shot ever since.
John, how you feeling?
I feel great.
Terrific.
But I only missed 1 day sick from work, and that was that time.
So glad you called. That was a great call. Thank you very much. You hear that all the time.
I hear that a lot. One thing I will say, the influenza vaccine in 1957 is very different from the influenza vaccine in 2017. We've made a lot of improvements over that period of time. The influenza vaccine is not perfect. It works about 60% of the time on average against mild illness, but it works much better. It's 80 to 90% effective at keeping people out of the hospital and getting seriously ill. So that's important.
Does it make anybody sick?
The influenza vaccine does not give you influenza. Again, the influenza vaccines in the 1950s were less pure. The current influenza vaccines have been extensively tested. It will give you a sore arm, so be ready. Your arm might hurt a little bit for a couple days, but otherwise, no serious side effects.
Barbara in Carroll County. Barbara, you're on MPT.
Yes, thank you. I don't understand the different types of flu shots that are being offered. There's a standard that protects for 3 types, and then there's one that protects 4 types, and then there's one that doesn't contain egg proteins. Then there's a high dose for people over 65, and one without preservatives, and there's so many different kinds. Now, I'm 72, and I really don't know which one to get.
Barbara, glad you called. We'll get you an answer on the air. Thank you.
So I think Barbara should be sitting here in my place because you reviewed very nicely the many different types of influenza vaccines. Again, we keep making improvements. The original influenza vaccines have 1 strain. We now have up to 4 strains in the influenza vaccines. For somebody your age, for people 65 and over, this is really important. We have 2 new types of influenza vaccine. They have been shown to elicit a stronger immune response, and it's the high-dose vaccine, which you mentioned, and also a vaccine with something called an adjuvant, which is a boost. It's an immune boost. So if you're over 65 and your physician has one of those 2 vaccines, I would recommend getting it. But any vaccine is better than no vaccine.
Very good. Jennifer in Montgomery County. Jennifer, thank you for the call. Go ahead.
Yes, good evening. I'm wondering, my mom is 77, and recently she was diagnosed with lung cancer, and I'm wondering if it is safe for her to have the vaccine.
Thank you very much.
Yeah, so it was asked whether an older person with lung cancer, if it's safe for them to receive vaccine. Not only is it safe, but it is absolutely essential that somebody with lung cancer receive the influenza vaccine. Influenza causes lung disease, and so that could definitely make your mother worse. I would also say it's very important that everybody else in the family and around your mom receive the vaccine, because she may be a little bit weak right now, and so people around her need to protect her as well.
Let's get one more phone call. Anne Arundel County, this is Colin. Colin, thanks for calling. Go ahead.
My mom says I have to get a flu shot. Do I really have to get a flu shot?
How old are you?
9.
Okay, we'll get you an answer on the air. Thank you for calling.
So, Colin, you are a very smart 9-year-old to call in and ask that question. You absolutely need the influenza vaccine. We don't want you to get sick. We don't want you to miss your soccer games. We don't want you to miss school. So your mom is right. You should get your flu vaccine.
What are you guys working on in the vaccine lab at University of Maryland?
So we're actually, later this year, in late December, we'll be testing an influenza vaccine against a new strain, a bird flu, which is an H7N9. You may have read about it. It's causing a lot of disease in China, and it's a very high priority for our government in terms of it's potentially could cause a pandemic. So we'll be working on that vaccine. We'll be looking for community volunteers later this year.
Who do you need in terms of volunteers?
So we'll be looking at most age groups 18 and over.
What happened to the spray? Wasn't there a spray version of a flu shot?
Yeah, that's a very complicated question, and children like Colin loved that spray vaccine. Unfortunately,
except you always saw pictures from some pediatrician's office of the kid squirming just as much as if it was a needle.
It gave us a choice, you know.
Right.
Do you want the spray or do you want the needle? You know, we monitor influenza vaccine safety and efficacy every year, and the nasal spray vaccine was just weaker than it should have been for a couple years in a row. So other countries still use it. We're taking a bit of a break. The manufacturer is looking into it, and we may see a recommendation again in the next year or two.
Dr. Kathleen Neuzil is director of the Center for Vaccine Development at the University of Maryland School of Medicine. Doctor, thank you very much.
Thank you.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.